Hello there, and welcome all to the beginning of your Level 5 Health and Social Care Award. Now, for those of you who've done Level 3 and Level 4 with us, you have to sort of be aware that we're moving up a step again to Level 5. So there's two aspects really. The academic aspect, which means that your writing has to again step up a little. You need to explain things, give examples, reference absolutely correctly, because this is pretty much like year 2 of an undergraduate degree. It's of that level, and your academic production needs to be of that standard. So remember, lots of nice references, good examples, explain yourself, and really pay lots and lots of attention to the command verbs. So when something asks you to evaluate or analyze, I can't just accept an explanation. You won't get marks for that. You need to do a proper evaluation, strengths and weaknesses, weighing up different opinions. You need to show a little bit more depth. And to reflect that, the assignments are much larger, okay, to reflect that level of explanation and analysis that you're going to have to put into them. Okay, the other point I wanted to say is that level 5 is also pitched slightly differently. Your previous levels had more practicality in them. They were a lot more about how you do things, and level 3, and then how you do things well, and they're starting to step towards the sort of supervision role. Whereas this is a slightly higher level because it's people who are preparing to become managers. So you need to take a much more aerial view of things. So there's going to be a lot more discussion about policy. There's going to be a lot more discussion about legislation. There's also you've got to reflect on not so much your own practice, but more about how things might work in an institution, what things you would have to do to improve care in that area. Okay, so you need to sort of think on a managerial level as well. Okay, so not interested in sort of day-to-day practice very often in the questions, the assignment. It's more about how you would operate, say, in your care home overall. Okay, so just try to sort of keep that in mind really, and don't get too focused on the personal, unless the question is very specific about that. Okay, so this is the principles underpinning health and social care. And this one unit really builds on everything you've done in your level 3 and level 4. So you might find in this unit particularly that we would be sort of going over old ground, but hopefully we'll be building on it, because again, you'll be looking at a more high level managerial view or more about the government policy around something, rather than just what you do in a day-to-day basis. Hopefully that will come clear as we go on, but as I said, this unit is particularly building on things that are going to be very familiar to you, having done the level 3 and 4. Okay, so let's kick off. So week 1, we're looking at values and safeguarding. Okay, and I've put the assignment criteria in so you can think ahead. And this week's work is going to relate to task 1, which, as you can see, is 700 words. And the overview of task 1 is about principles of support and how they're implemented. Okay. But the criteria that you're going to be writing to is 1.1, which is to discuss how health and social care values influence care delivery. We've talked about values a bit before at other times. And 1.2 is explaining the principles of safeguarding service users. And I know we've talked about that at great length. So hopefully you should be comfortable with that criteria. What I can't accept in your work is you writing to the individual criterias. Okay. I don't want a heading 1.1, 1.2. What I do need you to do is just to write to the task. I will find the answers for the criteria. Okay. So I'm not looking for headings. I'm looking for a well joined up functioning paragraph to make the assignment. Okay. So just pay attention to that, please. If you have any concerns about that or not quite sure what I mean, please WhatsApp me and I'll explain it to you in detail. Okay, thanks. Okay, so let's think about values then. What are values? Personal values, attitudes, and beliefs. Your experiences and your attitudes and your beliefs are really part of what make you who you are. They affect why you do things, what you do, and how you do things. They sort of relate who you might be friends with, who you might not be friends with, what sort of opinions you hold, such and things like that. And your attitudes and your values develop as part of your background. So your upbringing and your experiences and all the relationships that you have in that early time will play a part in the values that develop within you and how you see things in the world, how you see things around you, and the opinions that you hold about things. So it's very hard to move away from your background because it's a very influential part in developing your sort of moral beliefs and your attitudes. So a lot comes from your parents, your siblings, your grandparents, your families, all those people around you, your communities, and your culture, the culture that you're born into, the culture that you might end up living in. They all have a massive effect on the values that you develop. And sometimes your attitudes and beliefs could lead you to assume things about people that are not right or fair. This is what happens sometimes when we grow up in one culture, come to another one. Sometimes we have views about people that are not really appropriate, or it's just, it's just part of our background, the way we're brought up. But you need to learn, especially in the role that you're in, you need to learn to realize that fairly quickly and have the self-awareness to actually deal with it and be conscious of what you're saying. So we can't help the way we're brought up, but we can help what we do about it, I guess, is the thing. And as we've discussed before, you need to find out about the different attitudes and beliefs about other people that you work with and to see where that can be a problem, a difficulty, where you might not agree on things. And also think about not just the people you work with, but the service users as well. What is their culture? What is their beliefs? What are their understanding? Because we need to know that to make sure that we do the right thing and we don't offend people or we don't misunderstand people. So there's quite a lot to think about. And it really goes back down to your competency in the care field and how skilled you become at being aware of these sorts of things. As a manager, it's up to you to make sure that all of your staff have attitudes that are acceptable for the organisation that you work in, no matter what their personal attitudes are. They need to uphold the ones of the organisation, okay? And that would be your role as a manager to set the tone, set the standard, set the culture of the organisation to do that. So beliefs are things that you can feel very strongly about and they can guide your daily life and they're very, very linked to your morals and your values. That they tend to go hand in hand. Again, comes very much from your background and your upbringing. An example, classic example of a belief is someone who practices a specific religion, such as Catholicism, Islam, Judaism, anything like that. And together with that, there are loads of cultural issues to be aware of. So again, if you have the service user that may practices a religion that you're maybe not that aware of, you need to make sure that your team makes itself aware if there isn't anybody within the team who can give you guidance. And our beliefs might not necessarily be based on facts, but an opinion. Okay. So again, it's very much down to exposure. If you haven't been exposed to a certain religion, you might have these beliefs about it which are wrong. So you need to sort of tread carefully and be aware of that. They're not just formal beliefs as well, such as religion, but they can be about other things, what we morally maybe regard as right as wrong. And again, that can be down to your upbringing. So whether someone with a certain type of upbringing is very strict about, they would never steal, they would never harm another person. Somebody with a very different sort of upbringing, maybe, in a criminal family, might think it's okay to steal from people if they look like they've got more money than them. So they might have a different view as to what is right or wrong. And you, as a manager, need to be aware of all these things and make sure that when they are at work, they are working to the organization's standards of what's right or wrong. And that's down to your quality of your policies and procedures that are written down. Okay. Personal values, pretty much what we've been discussing already. They're influenced by our beliefs, and some of them can originate from prejudice, myths, or assumptions. And we need to constantly, as part of our reflective work, be aware of whether our values are influencing us, because they do. Sometimes it's, unconscious, but you need to do regular reflection on your work to think about, have you allowed your values to influence you? You need to talk to your supervisor or your manager about that. And remember, we weren't born with values. We were a little baby, and we picked them up as we went along. And as our life changes, sometimes so do our values. You might find the values you hold as a 17-year-old teenager who sort of probably doesn't like the world very much, to what happens when you're a 35-year-old mother with children. You might have totally different views on the world. So they are something that will change. They are not always constant. And again, your reflective practice should remind you, if you are changing your attitudes and you think they're misaligning with the work in the care field, then you need to reflect on that and see what you can do about it. Other values are professional values, and these are the principles that guide our practice. So things like, for social care workers, the code of conduct, the General Social Care Council's code of conduct. Those are the principles that guide our practice. Some of the values from legislation and government policy will also guide our practice. And the values of the organisation, who you work for, will also guide the service that you provide. Really, when you're at work, you've got to meet the organisational values and standards. What you do in your own spare time, what you think in your own spare time is down to you. But what you do at work is what the organisation expects you to. If you find there's a massive difference between your values and the organisation's, well, there's two ways of reflecting it. Either the organisation standards aren't good enough, or yours are a bit weird. So you have to decide, can you change? Do you want to change? And if not, maybe you should work somewhere else. I mean, that's part of it, really, isn't it? So, we've talked about those sort of values. When we work in social care, we do need to be aware that there may be some conflicts. Our personal values could be at odds with the values that we're required, that the organisation requires. And that's where education comes in, and training. So it's important especially again in the care field, there's quite a lot of mandatory training that needs to be done on equalities, on dignity, um, social inclusion, empowerment, those sorts of things. And hopefully that training will set the standard for how the organization operates, and that you will again change your attitudes to meet that. But do remember, when you take on a job, you are agreeing to hold and apply to the values of your profession and to fulfill your contract to the organization. So if you feel, as I said, that you can't work to their standards, maybe you need to step away, really. There can be a conflict though when you feel quite confident that you're meeting the professional values and standards, but your organization isn't. And that's where hopefully, as maybe a more senior role, you can try and put some things into practice and make changes. Generally, these things are picked up in inspections if they feel that the organisation isn't meeting the standards that it should do. But it can be something that you can actually help with if you feel that there's a chat. You might need to talk to senior management about it. Let's think about some of the government strategy that tries to reflect values. There's a history of it really, since the early 80s. One of the oldest white papers, Caring for People, sort of identified what the key values that were going to understand the government proposals, and it was really about promoting choice and independence. And that really came around, as I said, late 80s, early 90s. And these values were sort of focused on in the later papers, and carried on being focused on them for a good 10 years, and they sort of remain, although they have expanded the values. Well, as well as choice and independence, they've added empowerment, supporting dignity, and also some stuff about safeguarding as well, about protecting and keeping people safe. For a long time, it was just about older people's care and physical care. Then they developed some similar values for mental health service users. And then finally, they looked at learning difficulty services, and the value in people strategy was the one that actually started looking about the same values of choice and independence for people with learning disabilities. It took the government a long time to decide that people with learning disabilities had a right to choice and independence as much as everybody else did, because I think they struggled with the concept of whether some people with learning disabilities could actually understand those sort of concepts. But eventually, the practitioners helped them find a way. So they finally understood that there's always room for making sure that people get some choice, some independence, no matter how disabled they can be. And they're not everybody with learning disabilities is that disabled anyway. And that's one of the issues that they kept overlooking. They're only looking at people with high levels of disability and thinking, oh, can we write a policy for that? So valuing people is worth a read. It's a good strategy, and it really finally treats people with learning disabilities in the same rights as everybody else. So the current values for social care to date, I'm not saying that they won't change, because when a new government comes in, they do change policies. But these have stood the test of time, I would say, for the last 20 years. And they're regularly cited in all sorts of publications. So it's independence, citizenship, empowerment, social inclusion, a respect for diversity, and care and protection for vulnerable people and children and young people in the community. Okay, so those are the current values. Lots of ways of thinking about how you can actually meet those values and how you can actually push those values in your organization. think about what sort of examples you have. So to answer your question, how can health and social care values influence care delivery? There's some issues to think about. You've got the list of values. You could give examples for all of those from your previous experience of how that can affect care delivery, empowerment, making sure there's a service user involved in some of the decision making in the organization, service users committees, service users voting on things, service users being given lots of choice, those sorts of things. But there are other issues to think about. For one thing, one of the difficulties is people interpreting and understanding the actual value differently. And this could be just within your organization or within your care home, maybe that you work in. Or it could be with the people that you partner with that they interpret empowerment as one thing and you interpret it as another. So those sorts of things need to be thrashed out with some good, clear communication, and maybe when you write policies, you need to explain a little bit your interpretation of the value so that everybody's clear and knows what you mean. There can be tension between one value and another. So maybe you can sort of think this one through. What sort of area could be a tension between? The one that comes to mind quickly with me is independence, empowerment and independence, and also the safeguarding, protecting people, protecting vulnerable adults. So, if one of your service users is very vulnerable, but there's things they want to do, they want to go out to the cinema, they want to go out to a concert late at night, but they have vulnerabilities, there is a tension between those two. And we've talked about this before, particularly in the safeguarding units. And you can find quite a lot of evidence on it, really, to give me an example. The other issue to think about with these values is, are these, is the government asking us to aspire to them, or is the government saying, this is what absolutely must be happening in your care home now? And no one's really 100% clear on that. So you might want to think about that, and the only way to do that is maybe talk to your regulator. What do they think, Or do you just show the things that you're working towards? Or do you have to be there, boom, firing on all cylinders, full empowerment, full citizenship? I personally think they're aspirations, but I think it's up to the organisation to demonstrate they're at least meeting them all to a point. That's just my view, though. Okay, from my old local authority hat when I actually commissioned services, my view was I didn't think that everybody would be doing everything 100%, because it's quite a difficult process. But I assumed that people would be tackling every one of the values to a certain point. Performance management, nowadays lots of statistics are given back to the government, given back to the local authority who commissions the service, and usually at least on an annual basis, sometimes much more frequently than that. And it becomes very difficult for you as a manager, to identify what achievements are. And one of the things that has been identified is when you're having to keep producing information, performance management, you can actually end up doing more short-term little objectives and leaving aside some of the ones that are going to take a lot longer because you can't put an achievement in, but they actually could be much more valuable pieces of work. But you might have something that is going to take a care worker a year or 18 months to work with a service user on, and it could be one of the best things they ever do. But it's quite hard to say, well, actually, I can't report anything on that this year because, it's such a long process with these couple of service users. So it's easy to be pushed into looking at little short-term goals that you can report on, which isn't what performance management should be. I know, but in the performance management area, when I'm gathering the statistics and interpreting them, and then having managed the care homes and thinking, oh, blimey, I've got to come up with something, I do understand how that actually can be a difficult process. So that's one of the issues to think about as well. And a final issue that I've got really for you is workforce issues. So, in order for all these key values to be sustained, to be achieved and then sustained, you need to have the workforce totally embracing them and being able to do them. And one of the big obstacles is that our workforce is massively short. In this country anyway. I don't know if it's the same in the countries that you're working in, but we have a massive shortage of skilled and qualified staff across all sorts of areas in health and social care. And these staff shortages make it really difficult to meet all these values that we really want and to keep it up if we do meet them. So that means, sometimes services aren't delivered to the high standard that you would want because there's not enough people. And imagine, you should be doing something one-to-one with a service user, but you're two staff down, which you have been for the last couple of months. And you're just about sort of getting people up and getting them breakfasted and that, let alone doing anything sort of nice and one-to-one, working on their sort of personal independence thing, taking them down the shops when you haven't got enough staff to actually leave the building. Those sorts of things can be a real issue. I'd be interested to know if some of you, as practitioners, have already felt that problem. If so, you can put it in as an example. Remember, you need to be fairly anonymous, but you can sort of, quote a care home. Don't name the home, but just say a care home, I've worked that in Malaysia, does this, and this is one of the issues that I've observed, so you can put it down as an observation. So these are a few issues that I can offer you for your a discussion of how health and social care values can influence care delivery. We've talked a little bit about, the positive set of it. If everyone's working to the same standard, everyone understands and agrees the values, how good it can be. And then so you can give me some of the negatives as well, how it can maybe not happen as well. Okay. These are some of the references for some of the documents that I quoted in one of the earlier slides. And you can look those up if you want to read a bit more. So there's some extra reading here, and one of the things for level 5 is you need to do more of your own personal reading, because I don't want you just using the stuff that I put on the slides. Again, we're at second year undergraduate level here, so there should be a lot of your own personal work really. By this time at university, you're just given a question and you get on with it. So excuse me. So here's some extra reading for you. It will be in your resources. Okay, moving on now. We're having a little look at safeguarding. We've done an awful lot on safeguarding in the level 3 and the level 4, and you have a lot of documentation that you could have a look at. But again, I'm not asking you to go into the detail about safeguarding here. This is a bit more high level. It's about the principles of safeguarding. Okay, so 1.2 is asking you just to explain the principles of safeguarding. So here I've got a list of the principles, the 6 key principles that underpin all adult safeguarding work. And alongside that, if you can have a look at my little graphic, I've got some examples of what that means. So what I would like you to do is when you're going to talk about the 6 all you have to do for this one is talk about the 6 key principles, but maybe just give me a little example of that. You can either use that there, or maybe again, I've added some wider reading that I would like you to read because it's about quality and standards of safeguarding. And after you've read that, you can answer this question. So, first key principle is empowerment. It's about people being supported and encouraged to make their own decisions. And it's about things like informed consent. So, remember about discussing things with people, making sure that they are happy, gaining their consent wherever you can, and making sure that you give them all the right information to give their consent, not just asking them to consent for something when you haven't given them. And these are all sort of statements from service users that relate to the principles. For empowerment, I am asked what I want as the outcomes from the safeguarding process, and these directly inform what happens. So here the service user is acknowledging that they are being asked what they want to come out of this process. Okay, prevention. It is better to take action before harm occurs. This is really talking to your staff, and it's making sure that if they see something that they are concerned about, that they do something about it. It might not always be appropriate to intervene, but it is appropriate to report what they've observed. And when we talked about safeguarding in depth, we talked about the processes and the reporting processes. So here is, I receive clear and simple information of what abuse is and how to recognise the signs and what I can do to seek help. And this one is from a staff member saying that, through their training or through their sessions with their supervisor, they have the clear, straightforward information about what abuse is and how to recognise it. Okay. So then they can take action before. And, it could be something quite simple as if someone's wobbly on their feet, to make sure that they've got their walking frame to hand, because it's been acknowledged that if Mrs. Jones doesn't have a walking frame, she'll fall over and hurt herself. So, it could be, you're taking preventative action by making sure that before she starts to move across the room, she has her walking frame to hand. That's simple. Or it could be something much more complex about sort of personal abuse. And then some sort of observations would have to be put into place. Proportionality. The least intrusive response is appropriate to the risk. And this used to be a big issue with people with learning disabilities. They never got to do anything because most people felt that they were at risk and they weren't able to make decisions, and therefore they would get hurt. So they never even got to go to the shop sometimes on their own. And here, the least intrusive response is, this is about really getting to know the service user, know what they can do, and making sure a plan. And, finding out when you can step back and let someone go and when you need to support them. So the next one is protection. It's to support and represent people, especially those in the greatest of need. And again, that would be, again, people who maybe have communication issues, who have mental capacity issues. You need to be there to represent them. You need to speak up for them, stand up for them. So here they're saying, I get support and help to report abuse and neglect. I get help so I'm able to take part in the process as much as I can or much as I want. And sometimes you might need to get an advocate in for someone if they can't speak for themselves, but it's about you putting all the proper processes in place. Partnership, local solutions through services working with their communities. Now, the local authority have done, certainly where I've worked, have done quite a lot in the local communities to remind people in general that safeguarding is sort of part of their responsibility as well. And it's not just responsibility of people who work every day with service users, not just a responsibility of professionals like nurses, doctors, social workers, but it's actually anybody who sees anything in the community that they have concerns about, that they actually need to act on it and report it. Most social services would say they would rather someone reported it and then they investigated it and found out that, it was okay, than someone who didn't and something terrible happened. So it's really sort of saying that everyone's got a role to play, really. And working in partnership with some of the other professionals who might observe something, and having a relationship and a communication that they will pass the right things on. And we've got our confidentiality issues here, which you need to be aware of. If someone rings from outside and says, I saw one of your staff doing this, that, and the other to Mrs. Bloggs, who I've known for years, it's about how you manage the confidentiality of that information and what you do, and do the correct things with it, really. Making sure that it just goes to the manager, make sure it's recorded, making sure it's followed up. And also when a service user, again, this is something that's been discussed at length, when a service user wants to tell you something in confidence, you need to sort of think about what the need to know issues are and where it needs to go and tell them that. And hopefully the other professionals, like GPs, OTs, pharmacists who see people outside, that they might confide in about the care home, that they can come and work with you and do the right thing as well. Accountability is the final one. Accountability and transparency. So it's people taking responsibility, your staff taking responsibility for the bits they do, making sure they do their recordings clearly, transparency, making sure that the service user sees what you've written or is told or may get copies of. They may just agree with it, they might want to comment on it. And staff being responsible, not just ignoring things, knowing exactly what their role is, exactly what they should do and when. And really, a lot of this can be picked up in good policies and procedures and good training sessions. So that's all there is on the 6 key principles of safeguarding. Like I said, just explain the principles and maybe give me some little examples to show you understand them. But you don't need to do too much. I've given you some extra reading that might give you some ideas. Creating a safeguarding culture. It's a quick guide for registered managers. It's a useful read anyway. And making safeguarding personal. What might good look like for health and social care commissioners? So, if you're the manager of an organisation, what is a good service look like in the safeguarding department? So hopefully that will be helpful for you. You might draw some ideas out of that for your answer, but otherwise you might be able to draw some ideas from your own experience. Okay, so that's week 1. Okay, so hopefully that's been useful. As I said, any questions, WhatsApp me, and I'll see you in week 2. Thank you very much.